Hey, could turning 65 and moving from Obamacare to Medicare make a substantial dent into what you pay for medical insurance? Hi, I'm Jim and I was retired. In the past 4 years, I've been on Medicare, waiting for this time when my wife, Marie, would join me on Medicare. Now, 2 years ago, I shared this video that demonstrated how Medigap Plan N saved real money in my DIY retirement. By the way, this is my most popular video on my channel with 136,000 views in the past 2 years. Well, now I'm going to use 4 years of data to help Marie choose her Medigap plan for 2026. And I'll show you how in 2026, with both of us on a Medigap Plan N, it'll help cut our medical premiums in half. Let's get started. By the way, stay to the end and I'll review the spreadsheet that I used to show Marie how lower monthly premiums for Plan N will save us more than $32,000 over our retirement years. Now, to recap, I've been on Medicare for nearly 4 years, while Marie has been on the Affordable Care Plan, also known as Obamacare. And she's in her initial enrollment period for Medicare starting in January. When you sign up for Medicare, you are faced with your first choice. Do you stick with the original Medicare with Parts A for hospital care and Part B for doctors and labs, and then you add a Part D prescription drug plan and maybe a supplemental plan or Medigap to cover the 20% that Medicare doesn't cover? Or do you sign up for a Medicare Advantage, Part C, that turns over Parts A and B to a private insurer who may add that Part D drug coverage and maybe some extra benefits? But if you go that route, you will not be shopping for a Medigap policy because the Part C includes everything in that managed care model. If you do go with original Medicare, you will want to add that Medigap policy unless you have a retiree health care or union plan that will pay the 20% that Medicare doesn't cover. Now, Medigap policies are standardized by law and known by these letters. I've grayed out plans C and F since they are no longer offered to new enrollees. Most people choose Plan G or Plan N. Now, Plan G offers the broadest set of benefits for new enrollees. It covers everything but the Part B deductible, which changes each year. And in fact, Plans C and F, which had covered that, were phased out because Congress wants us to have skin in the game every year. So Plan G is now the most comprehensive, most popular, and most expensive in most markets. Here in New Jersey, in our part of New Jersey anyway, premiums start at $131 a month for a 65-year-old female with a household discount, which I'm hoping we're going to get. Now, Plan N covers everything that Plan G covers except Part B excess charges, but it uses these modest copays of up to $20 for an office visit and up to $50 for an ER. And in exchange for those copays, your monthly premiums here in New Jersey start at $100 for that 65-year-old female. So that's $30 less on these averages here from Medicare.gov. Now, some are scared off by this not covering excess charges. But I've shown before that Medicare.gov offers an easy way to ensure that your doctors accept Medicare assignment and agree not to bill excess charges. Also, the Kaiser Family Foundation reports that only about 1.2% of doctors have opted out of Medicare and can charge those excess fees because they don't accept Medicare assignment. Now, I chose Plan N from Mutual of Omaha, and I originally paid $112 for the first full year in 2022, in part because they gave me the household discount, even though my wife wasn't yet on Medicare. Now, without that discount, my rate went to $124 in 2023, and that's an increase of 10.8%. In 2024, my monthly premium went up 4.5% to about $130. And in 2025, my premiums were $139. That was up 7%. For 2026, I just received my premium notice since December is my anniversary month. And the premium only went up 3.2% to $143 a month. I was pleasantly surprised. Now, in my first spreadsheet, which is available on the Google Sites, I'll put up today's spreadsheet too, but I use this little chart to compare the average costs of Plan G and Plan N for the month and for the annual, and I looked at the differences, and then you calculate how many office visits of that $20, up to $20, how many office visits you would need for Plan N to catch up with the higher priced Plan G. This time I compared the averages for a 65-year-old female here in New Jersey, and for this exercise I used the averages of the rates posted by the New Jersey State Health Insurance Assistance Program, or SHIP. Every state has one, and you should check it out in your state. But here I use the average of those rates, and then I use that for the chart here. As the math shows, Marie would need to see doctors more than twice a month, every month, for the rest of her retirement to make Plan N as expensive as Plan G. Then I updated the inputs for my comparison spreadsheet. Now, in my original spreadsheet, I had like 2 office visits and 1 ER visit. And I've updated that over time. And 2 years ago, I think I updated it at 4 office visits. Here, I push the limits, and I have Marie seeing a potential copay of 12 office visits and 2 ER visits. Now, Marie sees doctors more than I do, but even that is more than what she sees typically in a year. Now, I've done that just to push the comparison of Plan N and Plan G. Now, I've shown the projected 2026 Part B deductible and Part B premium here, and those are estimates because the CMS has not yet made the announcement. They generally make it by this time each year, but I guess the government shutdown slowed things down. Now, it's also important to note that you pay those whether you select Plan G or Plan N. I continue to use the longer-term average increases for Plan G and the slightly smaller average increase for Plan N. And again, that's the long-term average. As you saw with my Plan N, the increases were 7% in 2025 and 3.2% for 2026. And I'll go to the screen recording to show you my comparison workshop for a couple, which will use our actual Plan N cost and Marie's actual ACA cost for the last 4 years, and slightly different rates depending upon age, because in most cases you're buying a plan that will go up with age each year. So here is the expanded comparison worksheet that I created. And in this case, I've added a column here for the actual ACA premiums that the younger spouse has been paying and the Plan N older spouse's actual experience with Plan N. But I've added the Plan G for the older spouse as the counterfactual. Plus, I've added columns for the Plan G for the younger spouse who will be getting different rates based on age. So here are the different ages for the younger spouse for a Plan G versus Plan N, and then their annual totals. And that all comes out here to the total health care for both. If they were both on Plan G, this would be the experience here. And if they were both on Plan N, so the formula here includes all of the premiums for Part B and Plan N for both spouses. Those values are in there twice, plus $20 times the value that you put in for office visits and $50 times the value that you put in for ER. Now, to keep this simple, I just used it once. And they were pretty high for even one person. So let's just say 12 office visits for both of us and 2 ER visits for both of us. And that's the figure. You could actually change the formula to do it differently for each spouse based on their medical needs, but I'm keeping it a little bit simpler here for this. And then that rolls down here to these formulas here that calculate how much more when the younger spouse hits 80, how much more they will have saved by going with Plan N versus Plan G. What path should we follow with both of us on Medicare? Now, that blue line over there shows the total health care costs with one of us on ACA and one on Medicare. And then these 3 lines show the counterfactual line up top. What if we were both on Plan G? Since I've been on Plan N, that's a counterfactual. The middle golden line shows what happens if the younger spouse chooses Plan G and the older spouse stays on Plan N. But the bottom green line there is the path that we will follow if we're both on Plan N. And when you run the numbers through the younger spouse's age 80, this couple would spend $227,824 for total medical costs with Plan N. And that's about $32,000 less than if both had chosen Plan G. And if one is on Plan N and one is on Plan G, the savings are there in the middle. Now back to that blue line, which shows what I have called the Catch-22 of one person on Medicare and one remaining on ACA. And it turns out that Harry Sitt, the financial buff blogger, reported on this quirk just this week. And I'll put a link to his blog post in the notes below. Let me know if you are in that Catch-22 situation and what you did to plan for that increase in cost for those few years and plan for when you're both on Medicare. Now, I'll show you here the real life numbers about what happens. I've tracked our monthly premiums for ACA and the monthly premiums that I've added for Medicare. And as you see, for the first few years, our expenses went up. And the trend got worse as the amount of the premium tax credit shrank with rising income. But the biggest surprise was the comparison between 2025 and 2026. We are spending $14.98 this year for Marie's ACA and my Medicare premiums. And when I project what we are going to spend with both of us on Medicare and a Plan N in 2026, that will be just over $700. That's cutting our premiums in half. But that's just the premiums. You need to add the out-of-pocket costs too, and they are based not solely on inflation or that crazy ACA formula, but on real-life things like what kind of medical care you actually need. So I used the data from my Quicken transactions to compute the average monthly medical out-of-pockets, and I projected to 2026 with the nominal copays under Plan N, as well as dental and eyewear care next year because they're not covered by Medicare. Based on these numbers, the medical costs were flat in 2022, increased about 9% in 2023, went up 3% in 2024, and then went up 8% in 2025. But in 2026, we will cut them 51%. That's real savings. Hey, be sure to like, share, and subscribe to this channel if you like entertaining ideas from a DIY retiree. I will conclude with my standard warning. I am not a professional planner. I'm not a Medicare broker. I'm just a DIY retiree. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one. Bye.